Assalamu alaikum and welcome to The Conversation with me, Talha Ahmed. Today, we'll be looking at the COVID situation in London Borough of Redbridge. As you may have noticed that we've been focusing on COVID situation in different parts of London. Not long ago, we had the Mayor of Needham sharing with us the challenges that COVID presented or continues to present in Needham. And we heard from her how they have sought to address the challenge. We also heard then from various community leaders about the challenges they faced and what they would like the local authority to see. So in that series today, we are joined by Councillor Jas Atwal, leader of London Borough of Redbridge, who has joined us to discuss the challenges that COVID poses in Redbridge and what they are trying to do to face that challenge. We will also hear from Dr. Awal, a former president and a retired NHS consultant, who will also share some of his concerns, and we will hear from Jas Atwal responding to those concerns. We'll also hear from an accountant, Syed Arif, who has a practice in Ilford, and we would hear from him about challenges that businesses are facing and how council is seeking to support them. But first, may I remind you that this show is for you, and we always aspire to raise your concerns and address your questions and share your comments. And therefore, today there will be no exception, and we would be delighted to speak to you. If you wish to do that, you will find the number on TV screen. Necessarily, we'll focus on our guest more, but we will try to take some questions from you, time permitting. I should also remind you that those of your relatives, friends who are not able to watch this program, or if you are not able to continue to watch this program live on TV, you can watch it on our Facebook page, live now, or at a time convenient to you. To do that, you will have to go to TV1 UK. TV1 UK Facebook page will have this program live now and have this program available for you to watch at a convenient time to you after this program has ended. So, let me welcome Jas Atwal. Councillor Jas Atwal, welcome to The Conversation. Can I begin by asking you to briefly share with us how, your thoughts on the impact that COVID so far had in Redbridge?
Sure. Thank you very much for having me on the show. I think that the effect has been devastating from day one, because nobody could have imagined that we would be living through this pandemic at the start of the year. And yet, within sort of February time, we were planning on buying, the personal protective equipment, the PPE. We were stockpiling food because we knew that we had 27,000 elderly people who may need food. And of course, we were setting up a volunteer service, and we were doing things that we wouldn't otherwise be doing. And all this was happening at a time when we were going into lockdown, and all the things that would make the council money, like having its libraries, like having its swimming pools, etc., open, and people would spend their money, all of those things closed. So you imagine, as a council, as a business, your revenue stops and your expenses start going in the wrong direction. And at the same time, the spectre of having the pandemic hanging over us, and of course not knowing that we were suddenly planning for so many more people to get infected and so many more deaths that would happen. And of course, this was happening worldwide, but particularly in the UK, the government sort of started setting up the Nightingale hospitals. And we, together with the government, were starting to prepare for, things that we were talking about at the time was mass deaths, things that we would never have thought about. So the effect of COVID-19 started off as devastating, and of course now we're coming to the second wave, and there's sort of 18 to 19,000 people getting infected on a daily basis. And of course, this is the flu season, and still all the extra costs, the financial burden on the council, whilst keeping its residents safe, whilst keeping all the other services running, has been huge.
Redbridge topped the list of worst affected boroughs in London in terms of infection rate and so on. Any particular thought as to why Redbridge has been so badly impacted by COVID?
Yeah, I mean, there are several factors that sort of come to mind. I mean, the biggest factor is that in Redbridge over the last 50 years, there's been really sort of a no real house building program. So whilst we have something like 310,000 residents living there, we've only got sort of roughly about 100,000 homes. And with that come overcrowding. So when you're living in close quarters, if one person gets infected, then the next person's definitely going to get infected. I think we are the second most overcrowded borough in the whole of London. A similar borough like ours, like Croydon, who've got similar amount of people, have got 156,000 homes. So clearly, you know, there are factors such as that. But one of the things I will say is that residents also, despite all the PR work by the government, by the council, making sure that all our residents are kept safe, all the messaging that's going out, still residents have, you know, not observing the social distancing, not observing the wearing of the face masks across when they're going to shops. Sometimes I've been to shops and I've been the only one wearing a face mask. We have to take responsibility ourselves as well as human beings. Everybody knows that the pandemic is on. Everybody knows that, you know, this is highly infectious, and we have personal responsibility to keep ourselves, our families, our friends, and our neighbours safe as well. So there's a multitude of things that means that Redbridge were most affected. I think now you'll see that most of the boroughs, that there's at least about 15 to 16 boroughs who are there, and there's about 5 or 6 boroughs who are perhaps now more infected than perhaps the people in Redbridge.
Redbridge also one of the boroughs that has a majority non-white population, and many of them, what we have seen so far, are more vulnerable to suffer disproportionately more from COVID. What I want to ask you is that when COVID struck, was there anything you particularly did or central government extended assistance to which sought to take into account the fact that it is such a diverse and mostly BAME population who are at a greater risk?
Yeah. The simple answer to that is no, because I think it was an evolving situation. We were finding out the facts as we were going in. So what we were concentrating as a council was to work with everybody to really sort of get the messages out, trying to get the same message out in 14 different languages, making sure that I was setting up WhatsApp groups in various streets, in the religious organizations. You know, we've got the faith WhatsApp group where once we put it on there, it reaches all faiths. So we've got the community leaders on there, we've got the faith leaders on there. So trying to get into each community and getting the messages right into the heart of all the communities in Redbridge has been the key. But in that first wave, the message was unraveling in front of us that there is a strong connection between a BAME community and having higher risk of getting infected by COVID-19 and then potentially it being fatal. And so in that first wave, I think we did everything for everyone rather than sort of having the time to concentrate on a single community, because we were all that single community. You know, it's the Bangladeshi, the Indian and the Pakistani community. I've lived there for 50 years and we were putting those messages out. And I think vast majority of the residents were taking heed of those messages. But then suddenly we had the summer come along, you know, sort of round about May, June time. And then the messages from central government started to be blurred. All of a sudden, you can go out. You can eat out to help out. You can go and hug your granny. We did that for a few months, and then suddenly it started changing. Actually, maybe eat out to help out wasn't a good idea. Maybe you shouldn't be hugging your granny. And now we're back into, you know, now we're into tier 2. and basically we shouldn't be mixing with other families inside. So we went from lockdown to relaxing the lockdown, and now coming back into restrictive measures, which is confusing because everybody knew. I knew. I had been looking at the government modelling. Other leaders knew. Everybody knew that the second wave was coming, and we'd all been told it was going to be in October. So I really don't understand why the mixed messaging happened in the summer when we should really have been getting that time to get our testing up to speed, getting the test and tracing up to speed. That's what's going to save the BAME community in Redbridge. Well, that's what's going to save everybody in the UK, is making sure that you have access to tests, the results come back very, very quickly, and if you prove to be positive, then you should be able to trace anybody you've come into contact with and isolate yourself. I mean, that simply is not working even now. I know the government will say, yes, it's sort of working, we've had success, but the level we should be at after sort of 8 months of now having had COVID around us, we should be in a far, far better position as a country to be able to say to our residents, look, if you feel that there's something wrong, go and get yourself tested. If you're asymptomatic, you have no signs, you should be able to go and get tested. Children who are going back to school, if they've had somebody test positive, should be able to get themselves tested. So all these things really need to be up to speed. I think that's the best thing we can help any community, particularly the BAME community, who are more likely to catch COVID-19 and for it to prove fatal, which is something we all want to try and avoid. It's the testing, the tracing, and the isolating. That is the key.
Thank you. We've got Dr. Awal with us, who lives in Redbridge and a retired doctor and former president of Friends of Bangladesh. Dr. Awal, I think you've got a question in relation to measures taken to live up to the tier 2 restrictions that Redbridge is under. You want to tell us your question?
Can you hear me, sir?
Yes, I
Dr.
can.
Awal, yes. Yeah.
Right. First of all, thank you so much indeed, TV1, for organizing such a beautiful program today, which is very relevant for the time. And good evening to Judge Atwal to come here to share with us the residents of Redbridge. I've been here only almost about 30 years, so I know Redbridge very well. So what I feel, I'm expressing my views, Mr. Atwal, as a local resident and also as a doctor as well. Not only me, I've got full of doctor, all my family, about 7, 8 GPs in my own family, fortunately. So I'm sharing all of their views to you. Now, may I ask you that the national guidelines is social distancing, also wearing the mask, as you kindly mentioned already, that the rules are rules. But I can see when I go to the street, people are not just obeying the rules. If they don't obey the rules, obviously, as you know, and as I know as a doctor as well, that infection is going to spread through their cough, through their speaking, through their breathing, touching the different things. So it's going to go up and up and up. So we have been, as a residents here, the victims of the situation. And partly what I noticed, that enough monitoring was not there. That's one of my observations. Second thing, if I may share with you, as you kindly said that you set up a WhatsApp group, but you possibly realize how many people are connected to the WhatsApp group. A lot of elderly people, as you mentioned, thousands of senior people. They didn't possibly even know what the WhatsApp group is. So, obviously, some of them are acquainted with that, but a lot of them are not. So obviously, we are not communicating to the most vulnerable people of Redbridge what they should be doing, what is the criteria, and what are the rules they should follow. So they are being exposed for non-information. So my question is, what role Redbridge has taken so far to avoid those vulnerable people, and did they tell about the imminent danger of COVID-19? What is your plan to reduce the COVID cases in Redbridge?
Thank you. Just well, two questions. One is what steps you taking or you plan to do to ensure that people abide by the restrictions that are imposed as a result of the crisis that we are in, and the other is is it really sufficient, or how are you satisfying yourself that you are reaching out to the widest possible spectrum in terms
I've got
of
one
your
more question
communication?
if I ask.
We'll come to that in a minute. Jasatwal, please.
Okay. Sure.
Thank you. I think, firstly, what I wanted to say is that the reason I mentioned the WhatsApp group was I was trying to actually prove that we're trying to go to the nth degree. When I mentioned the WhatsApp group, I mentioned it in the context that we managed to get all the churches, the synagogues, the mosques, and the mandirs and the gurdwaras on there, because obviously all the congregations of those religious places is an easy to reach audience, because once you reach out to the priests, the members of the religious organizations, you get down to the congregation as well. We've got the Redbridge Life, which is the newspaper that we have once a quarter, which we deliver to every household. And of course, we put all the COVID-19 messaging in there, and that got delivered to every single house. On our website, we've got a special sort of coronavirus hub. The libraries that have opened up have got the coronavirus information. And of course, we put this out there on the various social media, the Facebook pages, and of course, the leaflets in 14 different languages. So a lot's been done to try and reach out. And we've also got certainly our enforcement team to go out all the way through Ilford Lane, Goodmays, areas where we know that certainly the more vulnerable communities, the hard to reach communities, to try and make sure that we get through the messaging to the shopkeepers, to put the posters up, to check that the QR code's there, and make sure that we have a presence. So we try and get the message to everybody. Now, in terms of, that was the messaging side. In terms of trying to get the cases down, the biggest thing, which I said, is having access to a test so that if you feel that you are infected with COVID-19, you could actually go to a testing center, get yourself tested, and hopefully within 24 to 48 hours, you get the result. We've got, I think we're the only borough in London which has got 3 testing centres. We've got 2, one in the centre of Ilford in Mildmay Car Park, one in Ganshill in the library car park, and we've got another one opening, which should have been open tomorrow, but is opening on Saturday in Charteris Road car park in South Woodford. So we've got Ilford South, Ilford North, and the west of Redbridge as well. So it's critical, because that's the only way we can, at the moment, without a cure and without a vaccine, is to make sure that people have access to these tests, so we can highlight, if they're positive, that they can go home and isolate. And by making sure that we have our shops displaying the QR codes, we can help in tracing them. And I know councils up and down the country are doing the same thing. They're working their socks off to make sure that they keep their residents safe. The messaging, certainly, when we talk, I've sent out videos in Punjabi, in English, and I know that the council has organised videos, Bangladeshi, and certainly Pakistani, Urdu, in Indian Hindi. So we're trying to even get to the Lithuanian, the Latvians, to try and the Romanian community, to make sure that we try and get to every single one. And of course, there is a certain amount of responsibility as well that the residents have to take themselves, which is, the council has done so much, the news is there, we know we're in the middle of a pandemic. If you still say, it's not going to happen to me, that is foolish. And we've got to accept that there are some people who will always do this. But what sometimes disappoints me is that there is too many of these people who are out there, too many people who are not socially distancing, too many people not wearing masks and going into the shops. And of course, the council hasn't got the powers of fining people for not wearing masks in shop. That is only the police. So when people complain to me so many times, they say, Jazz, why don't you do this? Why don't you enforce this? the council hasn't actually got the powers to enforce. And even if they gave us the powers, would we have the manpower? Would we have the enough officers? We wouldn't. What we are asking government to do is to give us not only the powers, but the resources to go with it. Because there is a huge resourcing implication is that all this costs. And if you've got enforcement officers doing this kind of work, then there's other kind of work that they won't be
Mr.
doing.
Atwal, I mean, I hear what you say, but one of the concerns you yourself also raised, when we had the Eat Out to Help Out, I had the privilege, and every Tuesday at least when I come to this show, I drive along Cranbrook Road, and queues were long queues outside many of the eateries, often with no social distancing, rarely any mask. You mentioned the shops. And I've never seen a single sign of enforcement by police or anybody else. So what, I mean, surely you have, responsibility to see whether you can force the hands of the government or the police to more robustly enforce these restrictions.
Yeah, I mean, firstly, when it first happened, I thought it was a mad scheme. I know why the government were doing it. They were doing it to help the businesses out because they'd been closed for so long, which I fully understand. But ultimately, our health is more important, especially when, if you get infected, then there is a real chance that you may not make it, as many people didn't. And when people were queuing up, our enforcement officers who are out on Ilford Lane on a daily basis, especially in the evenings, we're telling people, you should be distancing yourself. But the powers of issuing a fine, if the residents know that all they can do is ask us, and that's it. We didn't have the powers to do anything. We still haven't got the powers to do anything. You see, one of my enforcement officers can fine somebody for spitting, can fine somebody for dropping their mask on the floor, for littering, but can't fine them, can't sort of tell them if they go into a shop without a mask, which is actually the law. And that's crazy because...
So whose role is it to fine people for not wearing masks? Who can impose fines if you don't socially distance or if you don't wear a mask? Is that just the police?
Just the police. That powers has been given just to the police.
But surely your local borough, I mean, you could push the police to have taken more proactive approach to enforce these rules.
Yeah, as you can imagine, the police have such a tough job as well because they're looking at gangs, they're looking at violent crime, and suddenly they're having to do, to keep people. On one hand, the government is giving them the message, eat out to help out, and then you've got the police managing the queues. I mean, it was never going to happen because the police already are stretched. They haven't got enough numbers, as we've seen over the years, the cuts that have happened. So the police were actually busy doing what they normally do, which is trying to tackle violent crime, trying to tackle drugs. But in this instance, a little bit of a collaborative working, perhaps giving the powers and giving the resources to local authorities to help out would have been quite easy. It's not as if we don't do this job anyway, because we do. I mean, ultimately...
Yes, speeding, etc., all these other powers you have.
Sorry?
I'm saying you already have some powers in relation to other matters where you can enforce. But
of course we could have, but the thing is, that it was made clear in the legislation that the only people who can enforce the mask wearing is the police, and that's why none of the councils up and down the country have been able to really control people going into shops without masks.
Thank you. We're going to take a short break, and we will then come to discuss some of the other issues. In particular, we would like to focus on the impact on local businesses. We would like to focus on the impact on poverty. Redbridge has over a third of its children live below poverty. And we would also want to hear the impact on education. But we will take a short break. Until then, do stay with us. Assalamu alaikum and welcome back. You're watching The Conversation with me, Talha Ahmed. Today, we are discussing the impact of COVID-19 pandemic in London Borough of Redbridge. And to discuss discuss the challenge and what is being done at the local authority level. We are joined by Jas Atwal, councillor and leader of the Redbridge Council. We are also joined by Dr. Awal, a clinician and former president of Friends of Bangladesh, and Syed Arif, who is an accountant and has a practice in Redbridge, who would share with us the challenges that businesses are facing. Before the break, we looked at the impact of COVID-19, and we looked at generally about impact and what may be the reason why Redbridge has been particularly badly affected. And we heard how a range of factors has contributed to it, housing conditions being one of them. But one of the concern, or perhaps a set of concerns that's been shared by Councillor Jas Atwal and also Dr. Awal, is the responsibility of those of you who live there, ordinary people, when we go to shop, when we go out, when we go to school, when we go about our business, and whether we live up to the responsibility that we ought to be. And one of the reasons we are covering this is so that we hopefully can raise greater awareness of the challenges that we face. And it's really important that every one of us take responsibility. And so when we go out, do take our mask with us, especially when we enter a confined space, shop, school, etc. And also to make sure that we follow the hygiene practice. Councillor Jas Atwal, if I may come back to you, one of the concern of this COVID-19 is the impact it will have on businesses. Redbridge has near enough, I think, 15,000 small and medium businesses, and the lifeline of London Borough of Redbridge, and indeed London and Britain, are these businesses. How badly are the businesses affected in Redbridge, you think, and what measures you have put in place to support them?
Thank you. I think businesses the world over have been affected badly. The first wave, when it came, we had the furlough scheme, which the government sort of paid 80% of salaries of people. And of course, there was local businesses who slipped through the net. If you're a sole trader, you didn't get the required support at the time. And then we had the grant system. We had £10,000 grants, which certainly the council were given the money, and we then passed on the grant to all our businesses, those that had the paid business rates that are on our books. And then what's happened is that businesses started coming back. And when it started coming back, that was when the trouble really started to hit, because business wasn't like it was before the pandemic. It was very slow. The only places that were really making any money are sort of takeaways. People still want to, have to eat. And so they were doing okay. But if you're selling something, people were suddenly not buying those things. And now we're going into the second wave, and we're seeing this up and down the country. Whenever you go, restrictions, you need to have the economic support. We've had the problem in Leicester. We've had the problem in Manchester, where the mayor is basically saying, look, you can put the restrictions on, but you've got to support the businesses. The £10,000 you gave 6 months ago, that's gone. These businesses, they need a new furlough system. They need new grants. They need new way of economic support. And as councils who are cash strapped up and down the country, what we're doing is offering advice, making sure that businesses who got access to grants that they can apply to, that we're getting them to them. And of course, if you are self-isolating, you can access the £500 for the 2 weeks that you are self-isolating, because we don't want people to be going back to work because they have to eat. So the government has put some things in place, and the council's job in this is to make sure we get the information to the businesses, having to write to all the businesses, reminding them of their responsibilities and reminding them of the things that they can apply for. And of course, then there are the general workers, the residents, who are depending on the furlough scheme. And of course, even the legislation was put in place that you can defer your mortgages, you can defer loan repayments, etc. So there's a lot that needs to be done, a lot that has been done, but it needs to be done on an ongoing basis. It's almost as if the government's forgotten the first part has happened, it's gone. The money's been spent. Now, as we go into the winter months, and who knows how long this second wave is going to be there for? Is it going to be there for 3 months or 6 months? And the businesses need that kind of assurance and that kind of help. And that's where we're pushing the government and asking them, look, economic support must go hand in hand with the imposition of local restrictions. And it can't happen like it's happened in Manchester or Leicester. London deserves, and the whole country deserves, every resident, every business deserves a financial package to help them get through this, because nobody's coming, nobody.
From what you see so far, are there any evidence or are you able to tell us as to how many businesses, or in terms of proportion, what proportion of businesses may struggle to survive at all? I mean, some big names has already indicated Flybe was one of the first one to sort of collapse as a big business. But are the local businesses likely to survive?
I think that there will always be businesses that will struggle to survive. But the benefit of a place like Redbridge, I think a lot of the shops, the greengrocers, the takeaways, the restaurants, it is getting them through this period. It's getting them through so that they got the business rates relief, so they don't have to pay any business rates until next year. Those kind of things that have been put in place, we've got to make sure that all businesses are getting access to that kind of help. In terms of how many will survive, I think in terms of if we were, say, West London, where there's Heathrow Airport, and a lot of this is to do with the airport. And at the moment, airports and aeroplanes and airlines are doing not a great business. So we would be under much, much bigger threat. I think businesses will struggle, but on the whole, because of the nature of those businesses in Redbridge,
they should be able to survive and
they've got to access the grants.
Thank you. Can I just, I know that Syed Arif has been waiting patiently for long, and he has a question regarding some aspects of the grant. So Syed Arif, do you want to very briefly tell us from your experience how badly some of the local businesses have been affected, and ask your question?
Yes. Thank you, Barrister Talha. Thanks for having me in the program, and the TV1 as well. And thanks to the leader of the council to joining us today. I'll state where I'm going to go to my question, because I know the program time is very short. My question will be to Jazz Atol. If Redbridge is in the similar sort of situation like Manchester, what we have witnessed for last few days, going backward and forward between the central government and the local government, negotiating the 65 billion or 65 million or 60 million. So that was a matter of only £5 million, but wasting the time when the COVID is spreading every day. Probably 25,000 people are being infected by this virus, and wasting the time. Are we taking the risk on life, and at the same time we need to save the business as well? So if, as the leader of the council, if your Redbridge council is in the similar sort of situation, so what will be your standing? Are you going to give the preference to the life, or at the same time you're saving the businesses? And if the fund, whatever is needed for the Redbridge Council, if that doesn't come from the central government, what are the alternative options that how council might help the businesses?
Thank you.
Okay. Now, thank you for that question. I mean, let me just be clear. Firstly, I think we're in a good place because the Prime Minister's constituency is a London constituency. So I think we may be saved there. So that's a good place to start. But the second part of that question was, would I be looking after life or businesses? It's going to be life every single time because, you only get the one chance. And I think I did say earlier, but I'll reiterate, the sort of things we've been doing is making sure that we have lots and lots of PPE, lots of masks, lots of aprons and gloves and hand sanitizers and antibacterial spray, everything, so that we've been stockpiling that because we know that we're going to need it on a long period in the coming months. Secondly, we've also established supply lines of food and vegetables, and so making sure that people who can't have access to food, that we will certainly deliver. Some of the nicest messages I got was when an elderly person wrote to me and said, rang the council thinking, they'll refer me to a local supermarket. I was so surprised when half an hour later, a young gentleman came along with a food parcel with lots of vegetables and fruit. We've got to do that. We as humans have to help each other to survive these hard times. And once we come out the other side, we will be stronger for it as a human race. But equally, we may not be as strong as we were as businesses, but we will have to rebuild. And the businesses, in terms of the grants, in terms of the advice, the council will distribute the grants, they will distribute the advice, make sure that those business owners, many of them who are local residents, certainly don't go without food, because that is the basic necessity. And that's going to be our number one job in the coming months, to make sure that we're on our residents' side and looking after the businesses the best we can, but life comes first.
One of the other concerns that some people raise is because of COVID-19, hospitals and GP surgeries and other healthcare facilities are becoming increasingly inaccessible for all sorts of reasons, and some quite understandable. And Dr. Awal has a question about access to GP services in Redbridge. Dr. Awal, you with us still?
Yeah, thank you very much.
You want to ask your question?
Thank you very much, sir, to giving me second time. I think it's an important question, as very kindly just Atwal said, life comes before livelihood. So in that case, life must be giving the preference. But at the moment, what I can see, GP appointment time in Redbridge is much longer than even our neighboring borough, Waltham Forest, for example. And at the same time, for seniors, shielding time has gone. Movement of the seniors are restricted, who needs most help. At the same time, as we know, almost 27,000 elderlies are living there in Redbridge. So we need help for them the most. Now, my question is, what plan you have as a leader of the council to offer medical help, at the same time to offer social help to these vulnerable elderlies in Redbridge? If you kindly brief it, and we know what it is. Thank you so much indeed.
Thank you. In terms of helping the elderly, the things that we've been doing is making sure our care homes are fully stocked up for PPE, making sure our council officers, certainly our outreach workers, our social workers, social care workers, they're actually reaching out to the residents. And the council for us was to take everybody offline, out of the council town hall, out of Linton House, and making sure that everything worked. We did that within the first week when we went into lockdown. We took our entire staff offline. And even now, nobody's working in the council offices. We made that decision because we want to be there for our residents. I don't want our staff to come back and then suddenly one person gets COVID-19 and the whole department has to self-isolate. So everybody is working remotely. Our children's services are reaching out to the children in need, and we're certainly reaching out to the adults. And our support network, the reason the GPs have always struggled historically in Redbridge is because of our low GP numbers. We were in the process at the moment when COVID-19 struck. We're building what's known as community hubs. This is trying to amalgamate services into one place. We're building one in Seven Kings, we're building another one in Gansil, and we've got another 3 planned. The idea is that we want to put like 3 or 4 GP surgeries inside those particular community hubs. That way, what we can do is reach out to the communities. These hubs are deliberately sort of scattered around the borough so that maximum walking time, not driving time, walking time, 20 minutes. So everybody can really access them. Now, in the near sort of immediate sort of future, I know that I got off the meeting with BHRUT, which is the Barking Havering University Trust, talking to them about making sure King George Hospital has COVID-free wards and COVID wards, making sure that the accident and emergency is accessible, trying to look at the pediatrics, what are we going to do? And of course, because we are joint with Queen's Hospital as well, making sure that the planning for the next few months is spot on. So there's a lot of work going on in the background, which people don't actually see. And we will be trying to make sure that the GP surgeries at the moment are not sort of accessible, because imagine the first thing you should be doing is, if you suspect you have COVID-19, is to go for a test, not go to your GP, go for a test. Once you've had that test, the only thing you can do is self-isolate. And you should be ringing your doctor up for all the other illnesses, and certainly ringing your doctor up to tell them if you've got COVID-19. But ultimately, you've got to be keeping your doctor's surgeries free from this, and we're trying to make sure that our hospital is free, is demarcated clearly, which are the green and non-COVID wards, which are the COVID wards, because we want to make sure. So there's a lot of things happening. It's hard to answer that question in one, because it is, again, trying to plan for something which we weren't ready to plan for only about 8 months ago. It's a real life situation.
Thank you. We are almost coming to the end of our program, but very quickly, I want to gauge your thought. I know that we know that Redbridge, almost a third or just over a third of children in Redbridge lives below poverty line, and most children who are in those families probably are also worst affected financially, potentially also health-wise because of COVID pandemic. What measures you've taken to support those families and children and young people to make sure that they don't fall even further into poverty?
Yeah. Well, firstly, we made sure that all our schools, when they opened safely. I know I went to great lengths. I challenged every single school, and every single school had to give us their risk assessments, and I had to, my department, the education department, diligently went through every single school to make sure that they had help. And 95% of all schools in Redbridge are either good or outstanding. I mean, the one thing Redbridge is absolutely renowned for is the education. That, it is second to none. It is one of the best in the country. And certainly once we've got to the COVID situation, as children are catching COVID-19 and they're isolating, all our schools are now starting to run lessons remotely, especially for those who are shielding. I think, I can't tell you the exact number at the moment, but sometime last week, I believe there was about 2,900 of our children who were isolating from schools, but lessons were running normally. And when the government made available the laptops, etc., we made sure we applied for as maximum we could have, and we made sure we gave them to those laptops with the supporting equipment to the children who are certainly on our register as vulnerable and living in deprivation. And of course, it wasn't enough. We'd like more. And we've had some community members who've certainly saved up and donated some of these laptops. And we're sort of working on making sure that we get all our communities reached, and making sure that we try and get those laptops so that they can do their remote learning. But ultimately, I go back to that same point. If we want to help our children, we need to get our testing right so that once you've tested and it's a negative result, you can get them back to school. Because rather than having 2 weeks missed, it's better to get the test and get them back to school. When they're at school, certainly their mental health is better, they're out and about with their friends, and they're actually learning. So it's that testing. That's why we went for 3 testing centres, and I'm really proud to say that we've got all 3 as of Saturday in all parts of our borough.
Thank you. Jasatwal, leader of Redbridge Council, and also we were joined by Dr. Awal and Syed Arif. There are many other issues that we would have loved to explore, and I'm sure we'll have opportunities in the future to explore them. But for today, that's all we had time for. But before we leave, I just want to reiterate what our guests has said repeatedly today, and that is, we all have to take responsibility. We are going through an unprecedented time. None of us could have planned to be in the situation that we are in. None of us could have really foreseen and be prepared for the challenge that we have seen. Government need to take greater responsibilities and ensure that it doesn't send confusing messages. Local authority has to take responsibility, but we all must take responsibility. We must observe the hygiene practices, wash our hands frequently, and maintain social distances, wear masks whenever we go out, especially if we enter a shop or an eatery. If we don't take care of ourselves and our neighbors and our relatives, no one can fully protect us. We hope and we pray and pray that you all remain safe, remain vigilant, and remain responsible. And until next week, that's all from us. Thank you for watching from home. Thank you to our guests who gave up their valuable time to join us. And do watch this program again on our Facebook page, TV1 UK. TV1 UK Facebook page. You can watch it from now or anytime at your convenience. Allah Hafiz.